The airline industry has taken a major hit during this pandemic, and just as passengers are starting to return in small numbers, a new surge in coronavirus cases is stalling that industry's recovery. NBC News correspondent Tom Costello reports from Reagan National Airport.
Hey, Savannah, good day. So as you know, we have seen an increase in air travel ever so slightly, but nothing like what we had a year ago. Airplanes right now not full generally. Airports certainly not full. United Airlines just announced that it will extend its mask order to the areas of the airport that it controls. And if you refuse to wear a mask on United, and Delta for that matter, you could be banned from flying on that airline going forward. But when will air travel return to pre-pandemic levels? Experts now say that could be 2-3 years, even longer.
4 months into the global pandemic, the coronavirus has the nation's major airlines bleeding cash, even as some passengers start to trickle back to the skies.
Travelers are very concerned about catching COVID-19 on an airplane. More than 4 in 5 express this fear.
Just a couple of months ago, airlines saw passenger levels drop off a cliff, down 95%. Those levels now closer to 74% less than last year, but that has stalled as coronavirus cases have surged in the South and the West.
As long as we see COVID-19 continue to spread around the country and we don't see a break in the infection levels, we're going to see real limited numbers in terms of people taking flights.
United Airlines now says it's losing $25 million a day. Delta says its daily cash burn rate hit $27 million a day in late June, down from $100 million a day in March. And with federal aid expiring in October, tens of thousands of airline workers are facing the very real threat of furloughs, with flight attendants expected to take the biggest hit.
We are preparing to be a smaller airline over the course of the next couple of years, and that's why we've already had 20% of our people voluntarily retire.
Delta CEO Ed Bastian says with so many people now working from home, another challenge is the significant drop in business travel, which industry groups say can account for 60, even 70% of passenger revenue. Then there's the patchwork response to the pandemic from state to state, with some, like New York, requiring people coming from hotspots to self-quarantine.
That's a big disincentive to travel, period, because it doesn't matter if you're flying or driving to any of those 31 states, you've got a shelter in place for 14 days.
The major carriers all require passengers to wear a mask or face covering in flight, but Frontier is the only airline currently doing temperature checks. Still, experts say with all the cleaning procedures for healthy people, now is a relatively safe time to travel.
From a cleanliness standpoint, there's probably never been a better time to fly than now. But airplanes are public transportation, so be considerate of those around you.
One other storyline that we will be watching closely. Remember the 737 MAX story? It has been grounded, as you know, since March of 2019 following those 2 crashes overseas that killed 346 people. The FAA is still reviewing the 737 MAX, still reviewing the software fix for the MAX. That review could last into the fall, maybe even into the winter, which means that plane may not fly until next year in the first quarter, and that would mean it would have been grounded for nearly 2 years. Unprecedented. Savannah, back to you.
Nursing homes in Florida are in crisis mode. The number of people infected in these facilities has more than doubled in just the last 3 weeks. NBC News Now correspondent Dasha Burns is in Hialeah, Florida, the city with the most long-term care facilities in the state.
Hey, Savannah, the surge in cases in Florida is posing a major threat to the state's elderly population. 1 in 5 residents here are over the age of 65. The state has 154,000 people living in nursing homes or assisted living facilities. And over the last 3 weeks, cases among residents and staff at these facilities have more than doubled. It has local state officials on high alert. Just earlier today, Governor Ron DeSantis tweeted an announcement on more action that the state is taking to take care of these facilities. He said In March, I directed the Florida Health Department to send incident management teams to all Florida long-term care facilities. We are now deploying these teams for a second statewide mission. Now, leaders in the industry are also sounding the alarm. Earlier today, I spoke with the president and CEO of Leading Age Florida. They're a group that represents aging services providers. Take a listen to how he described the situation.
If COVID-19 were a hurricane, it would be a Category 5 hurricane in Florida. The nation knows that there has been a spike in cases in the last few weeks in Florida. And the reason that that's important to us in the long-term care field is that the nursing homes and assisted living facilities are microcosms of the cities where they exist.
And Savannah, local officials have emphasized to me that what happens inside of these nursing homes is impacted by what happens outside in these towns, in these communities. And right now, the spread of COVID is so high in these areas where employees live. And that's often how the virus winds up in these nursing homes. They're asking for more support, more PPE, and more testing, and quicker turnaround of testing as well in order to protect these vulnerable populations. Savannah?
Tennessee is going back to school. Students returned to class for the first time today with new restrictions in place aimed at keeping them safe. Classes have fewer students with more social distancing. Masks are available and highly recommended, but not mandatory for students. NBC News correspondent Blaine Alexander takes us inside a high school in Alcoa, Tennessee.
Well, Savannah, here in Alcoa, Tennessee, just outside of Knoxville, this is the first day of school, but it certainly looks much different than the first day of school typically looks. That's because of the 2,000 students here at Alcoa City Schools, a small district, only about a fifth of them are coming back today. That's because they are doing this in staggered shifts. Students are only coming to class 1 out of every 5 days a week. The rest of the 4 days are going to be virtual learning. Now, it's important to note that in addition to the partitions inside, the distance desks, the washing stations, teachers and all administrators, all adults are required to wear face masks. It's strongly encouraged for children, but they say that they're going to make this kind of a learning experience. I spoke with the principal here at Alcoa Elementary School, and she said that what they're trying to do is they're trying to make it fun, but they're really trying to educate the students every single day on what this hygiene looks like, what it means to wash your hands, wear masks, things like that. Now, two important notes to point out, Savannah, is that one, if parents don't quite feel comfortable bringing their students back, they can opt for all virtual learning. Some parents have chosen to go that route. The other thing is that this is going until Labor Day, and at that point, the district says that they will reevaluate to determine what, if anything, needs to change. Savannah.
Coronavirus is crippling a border community in Arizona. Santa Cruz County has the highest rate of positive cases per capita in the state.
We saw our spike much later than other people have, and right now, based on 100,000 population, we're the county with the most number of cases in the state of Arizona.
NBC News reporter Vaughn Hilliard joins me now from Nogales, Arizona. Vaughn, what's the situation like there?
Savannah, you know, we so often pay so much attention to Phoenix, to Tucson, those main metropolitan areas here in the state of Arizona. At the same time, down here in Santa Cruz County, this is the county that has the highest per capita positive COVID rate of any county in the state. We're here in Nogales. You can see up on the hill behind me, that's actually Nogales, Sonora, Mexico. Nogales on the United States side is about 22,000 folks strong, but there is a lot of cross-border traffic usually. Obviously, that's a little different, and that's why you see the street behind me here quite quiet. This is not what a normal summer looks like here in Nogales. But what you're seeing here in Santa Cruz County, it's a continually high number of folks that are testing positive. Not only is it the highest per capita positive rate, when you look at the percent of folks who are getting tests that come back as positive, that percent positive number is staggeringly high. To give you an idea, over the course of 2020, it's more than 33%, but just yesterday alone, that percent positive rate here in Santa Cruz County was 55%. Compare that to Maricopa County and Phoenix of just 19%. It's just an indication of the demand here, for the demand and the need for an expanded testing here to really get a good grasp and to get a good control on the spread here in this area.
And Vaughn, one of the things I know specifically about where you're at is that this is a tight-knit community where people live and interact very close together. What's being done to keep people safe when that's sort of how they live there?
Exactly. You have a lot of multi-generational homes. It's more than 80% Latino. This is a very tight-knit community. You know, there's also a significant produce distribution operation here. Several thousand folks working in that line of business. And when you talk about essential workforce, that's essential to get the crops from Mexico into the northern part of North America. That is funneled right through here. Billions of dollars worth of distribution comes through Nogales every year. You know, I was talking to one gentleman who is the owner of one of those distribution centers, and he said it's important for us to keep our workforce safe because we don't have the luxury of working from home. You know, I was also talking with a doctor, Dr. Philip Williams, who works over at the Mariposa Community Health Center, which does about 70% of the health care providing here across the county. And he was telling me that because of the tightness of this community in the way in which business and the economy operates here, that is a big part of the reason why you see spread. Take a listen to part of my conversation with Dr. Williams.
It's very common to have multi-generational families in one house. So you'll have, you know, mom, the kids, the grandmothers, the aunts, all living under one roof. And, you know, it's one of our greatest strengths just because family is so prized here. But it also, from a public health standpoint, has proven to be a real challenge.
And that is where Dr. Williams says it's so important. I was talking with actually a colleague of his, Viviana, who she works at that health center, and she contracted COVID herself and was out of work at the health center for 2 weeks. Her husband, though, also contracted it. He works at one of the produce distribution centers. He was out of work for more than 2 weeks, and both of their kids tested positive as well. Just one example of the way in which families here are impacted.
Absolutely. Now let's talk. I know you're talking about these people that are working in the healthcare system. What has the strain been like on the healthcare system in this community?
I mean, even before we get back over to the community health center here, let's just look at the fire department. The Nogales Fire Department is about 42 folks strong, and at one point they had 7 down at one time who had tested positive. These folks are directly the ones interacting, for the most part, with a lot of the COVID patients that need help. Rio Rico Fire Department has helped out. They're the community just north of Nogales here. To give you an idea, I was talking with the chief from the Rio Rico Fire Department, and he was telling me that they have already transported 216 individuals from Nogales up to hospitals up in Tucson, which is more than an hour north of here. Again, 216 individuals taken from the health facilities here to go and get treatment up in Tucson. I want to let you hear from Dr. Pereira, a longtime chief medical director here in town at Mariposa Center. I think he gives you an idea of what is needed in a community like this.
We have learned a lot from other countries. We know from European countries where the rates of COVID-19 have dramatically decreased. They've implemented measures to make that happen. So we know what it is. I think we just need to get together as a country, leave certain divisions aside and make it work. Other countries have done it. There's no reason that we cannot do it.
What you heard from Dr. Pereira, Savannah, is not only an emphasis on states working together and the United States federal government coming up with a coherent plan, but also the transnational issue at play. Nogales, Mexico, Nogales, America. Essentially, it's one city. They're sister cities. And there's typically, you know, tens of thousands of folks that go back and forth for work and to shop at these stores here. But that's not taking place right now. And that's why the folks here in town emphasize that there also needs to be a transnational relationship to really be able for the economies here in border communities like Nogales to really pick up, open up safely, and to rebuild themselves into the communities that they once were.
Vaughn, I know a lot of what you're talking about is happening. I'm in California. In our border communities here in Imperial County, very similar storylines going on in a lot of these border communities. Now, let's talk about the county's economy. You're mentioning people who are getting sick at these produce plants, these things that provide lots of jobs for these communities. How's the economy doing?
The economy, you know, I was talking with the county superintendent here and just a bit ago. And, you know, this is a community. Again, you can't separate COVID from other policies that have been enacted in the past. And when you go and look at the border wall behind us here, there's barbed wires that line the wall itself here. And with the emergence of COVID, there's an extra layer now of apprehension of folks going between the two countries. Both sides have, for days at a time, have closed off access to Mexico, and then U.S. officials have closed off American access to non-essential workers. So right now it's only essential workforce that are allowed to come in here. And folks that are looking to go shopping at any of these stores here are not able to come over right now. And that is essentially dried up and forced these stores to close because they don't have that sort of walkability access that you'd normally see here in the streets of Nogales. Again, I just emphasize that this is over not only years of time, but decades of policies that, you know, get to this point. And so when you have a pandemic hit, it's unfortunately the perfect crux for communities to struggle economically. Not only do you not have folks working, but also that puts, you know, the livelihoods of the folks working at those produce type places sort of waiting and hold. Savannah?
The difficult thing that we're seeing play out across this country, this double whammy of the healthcare systems and the economy. Vaughn, thanks so much for reporting on this for us.
Thanks, my friend.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.